Good morning, members. It's time to start our meeting. We have formed a quorum. I now call the meeting to order. As the guests are coming in to join us, let's deal with the agenda. No information paper has been issued since the last meeting. And today we have only got one item on the agenda, and that is a pilot scheme on residential care service voucher for the elderly. And I have to apologize first because it was supposed to be held on Monday, but too many deputations and individuals would like to attend the meeting. And we were criticized for the arrangement for the last scheduled meeting, and today we rearranged meeting. We allowed more time for deputations to sign up, so today's meeting will last for 3 to 3.5 hours. We have a motion to handle. Let's see when the mover arrives. And if the member arrives after the first hour of the meeting, we will handle the motion after 11:30. So please return to the meeting for the motion. I would like to welcome the officials, the Secretary for Health and Welfare, Mr. Matthew Zhang, Mr. Annie Tam, the Permanent Secretary, Mr. Dr. Lam Jing Choi, the Chairman of the Commission on the Elderly Commission, Dr. Lo Chi Kong, Mr. Chui Tai Mo, Mr. Donald Chan, Deputy Secretary, LWB, Mr. Chia Ling Chun, PAS, and Ms. Pan Kit Ling, Assistant Director, SWT. I also like to thank all the deputations and individuals. Please take your seats. Maybe it's time to deal with some in-house administrative matters. Today we have 35 deputations and individuals who would like to speak at this meeting. May I remind you that if you use the mic and the earpiece, channel 0 is floor, channel 1 Cantonese channel 2 English, channel 3 Putonghua. Each deputation or individual has 3 minutes to speak. And you should note that your speeches and submissions are not protected by the Legislative Council Powers and Privileges Ordinance, Cap 382. The same applies to your written submissions. So please note that. For those in the gallery upstairs and also in the meeting room, you can see that there is a notice to the people attending legislative meetings in the public gallery. So please note the relevant rules in the notes. Over to the Secretary for an introduction of the paper. It's a new paper. Please pay attention, members. Well, thank you for arranging this special meeting. And some of my team members were originally going on duty out of Hong Kong, and they have changed their schedule so that they can attend this meeting and listen to your views, so that we can. In 2014, the CE announced in the policy address that Dr. Lam and the Elderly Commission was commissioned to carry out a feasibility study on the residential care service voucher for the elderly. And there's a consultant team. Dr. Law and Dr. Choi are here to carry out a study and to assist in the work. On the 7th of June, the Elderly Commission vetted and approved the final report of the consultant study, and the report has been uploaded to our website. I will invite Dr. Law and Dr. Choi to do a brief PowerPoint presentation, and then Dr. Lam would say something about why the Elderly Commission has accepted the package, and I will be doing then a summing up. So we want to give you the full picture, and we will not exceed the time limit. PowerPoint, please. Dr. Choi. Well, time is short, so I shall be brief. This is the study that we have carried out. The background has been referred to by the Secretary. In 2009-2011, there were some studies on residential care for the elderly and community care for the elderly. And the study was about the introduction of a voucher scheme, having make reference to overseas countries, and then there was the pilot RCS voucher scheme, and then there was the pilot CCS scheme, and then we wanted to know whether it can be extended to residential care as well. You know, the service delivery mode is a mixed one. There are the subvented contract, self-financing homes, and there is the enhanced bought place scheme. You can see the ratio of different categories. On the whole, 1/3 subventioned and 2/3 bought place or non-subvented. And the government has been providing resources to increase the number of subvented places with the aging population. There's no means test for subvented service. There's only a physical assessment. And as a result, with the aging population, it's expected that the demand will increase. The waiting time is rather long. Because it's a subvention service, a subvented service, the elderly would get a direct subsidy, or through CSSA they get a subsidy. Some 60% of those in the homes are on CSSA. As for those who are accommodated in non-subvented homes, 80% of them are getting a subsidy from the government. As for the consultancy team, we have a team from the Hong Kong University. We carry out certain research studies, such as literature research, and also the survey among 300 subvented homes to look into the service delivery and other issues relating to the voucher scheme. We interviewed different stakeholders, including service recipients, service users, and service providers. We also provided some information to the respondents. For example, information about the A1 homes, and also the information on the means test, and also the co-payment arrangement. And here are the findings of the questionnaire survey. More than 30% of the respondents were willing to accept the arrangement under the voucher scheme. And if there will be a means test, the percentage will change to 11.8%, and 40% would consider using residential home services when their physical conditions are warranted, and 48% would consider using the voucher for the purpose of getting residential care services. And I will skip the next part concerning their financial status. Means that many respondents are willing to be means tested, and many respondents are agreeable to a tiered subvention or subsidy. That is, the subsidy would vary depending on the financial status of the service user. And other people are willing to make some payment themselves. That is co-payment, or on top of the amount of the voucher, they are willing to pay something on top. Among CSSA recipients, about half of them are willing to withdraw their CSSA applications if they are given a voucher. Based on the ratio of 11.8%, we project the number of people who will be using the voucher system. Based on the figures in July 2015, there were 25,000 people on the waiting list. So a substantial number will be interested in using the residential care service voucher.
我想講喺啲非資助宿位服務訪問啦，咁而亦都有唔同嘅比例嘅。
And here are the interest expressed by the respondents concerning the different types of residential care. Subventors 61%, self-financing 30%, A1 enhanced workplace homes 90%, and A2 the workplace homes another 30%. So quite a large number of respondents are willing to use residential care service vouchers, and many service providers are willing to provide the service under the voucher scheme. We also attended some meetings to gauge views of stakeholders, and also we answer their questions, and we have come to realize that there are some major concerns. First, the service level. We agree that the relevant standards under Grade A1 homes should be adopted as the minimum. But some of the respondents are of the view that supply may be a problem if the standards are set at a too high a level, and if it's set at a low level, then service quality will be affected. We believe it's appropriate at this point in time to adopt the standards related to A1 homes. And that's the concern that people would be admitted to residential care homes prematurely, and that is to say these people should not have been admitted at such an early stage. And we think that the voucher scheme would not become a major incentive for people to be admitted to a home, because there's the physical assessment criterion. And so this, whatever decision is made, it will be an informed decision of the service user. And at present, about 22% of applicants refuse to accept the offer of residential care home place. So not everyone would go to a home if a place is available. So we don't think the scheme will become an incentive, so much so that many elderly people are admitted prematurely. And also there's the concern about case worker. I think we would like to have a case worker to provide suitable information to the user, and it would be more appropriate for the SWD to provide case management service. And also we adopt a random system to distribute voucher. It may be unfair to certain elderly people, and so it would be fairer if we allow all to participate, and that's why we have made certain adjustments to the proposals. And then there was the incident involving some private residential care, and we look into the case and enhance our proposals. And after intensive discussion with the SWD, we think that we can introduce management measures to enhance service quality. For example, the SWD would provide more manpower to do the inspections. And also stakeholders and service users will participate in the service quality monitoring work. And we would provide dedicated website to provide information to the waiting list applicants and other stakeholders. So the study team has the following proposals to make. First, we hope that all the residential care homes in the 18th district would be accepted for participation, and they should be at least have the space and manpower levels up to A1 grade, and they should have a clean record as regards service provision.
So for this voucher, we have to ensure that the service provider would not deny service to voucher holders without reasons, and also will ensure that the elderly persons in need would get the appropriate services. There will be 3 phases in the rolling out of the voucher scheme. We will look at the result of each phase, and then we will make improvement accordingly. And also, we propose that the SWD set up a designated team of case managers so as to provide information to service users. And also, when the service users use the vouchers, the case managers will make sure that they receive quality services. And also, we suggest that SWD set up a dedicated website to provide information to the public and service users, including the types of services, the locations of the RCHEs, the number of places, the staff of deployment of the RCHEs, etc. And also for the wait listees, if the elderly persons are moderately or severely impaired, they would be eligible for this voucher scheme. Well, there will be several phases of implementation. So for the first phase, service users, if the number is on the high side, and if there are not enough vouchers for them, then we would accord priority. For example, we will look at their physical condition, their asset limit, etc. And also, the case managers will help the elderly persons to make appropriate decisions, and they will continue to monitor the service provided to the users. And after the trial period, if the service users do not plan to continue receiving the service, then they can go back to the central waiting list. But if they decide to use the voucher, then they should leave the waiting list. As for voucher value, it would be aligned with the EA1 level. At present, it's $12,416. So for elderly persons with different means, they would have to make different co-payments. There will be a sliding scale because we want to allocate the resources in a reasonable and fair manner. So for this table, you can see that there are 8 levels. Level 0, those with the least means, and level 7, those with the most means. So this would be, users will be assessed on an individual basis in the means test, and both asset and income will be taken into account. So if they have less means, then they will get more subsidy from the government. Now we have some CSSA recipients, and we also have elderly persons who are at level 0. So we propose that other allowances be continued to give to them. For example, the healthcare allowances for healthcare items. And also, as other CSSA recipients, they would also receive healthcare assistance. Well, for CSSA recipients, for a singleton elderly person, now the subsidy is about $7,000. For the voucher value, it will be a bit higher than this level. So for CSSA recipients, if they use the voucher in the future, then they would have to withdraw from the CSSA's system. Other than co-payments, there will also be a top-up arrangement. That is for the elderly persons and their family members. After receiving the service, which is at a level of $12,416. If they pay more, they can also get better services. But some elderly persons may be very wealthy and they would like to top up a lot, but we do not want to render the voucher value inappropriate, so they would not be allowed to pay more than to top up by more than 75%. As for quality assurance, we are making 3 suggestions. The SWD will monitor the RCHEs. Inspections will be stepped up, and also there will be surprise inspections. As for service providers, they must join the service quality group, and there are other stakeholders in this group. If they do not comply with the relevant agreements, there will be warnings and sanctions. For example, they cannot get more than 3 warning items in a year. So for the implementation of the scheme, we will be reviewing the scheme from time to time so as to ensure that quality services will be provided. Thank you. Secretary. Dr. Lam, the chairman of the Elderly Commission, will also make a speech. Thank you, Chairman. I would like to thank my colleague for explaining to you in great details about the feasibility study. Ever since 2014, we started the feasibility study. Unfortunately, last year, there was the Cambridge elderly home incident. For this unfortunate incident, actually, it gave us an opportunity to review the whole scheme again, because we really want a scheme to help elderly persons, in particular those who are living in licensed RCHEs. After the Cambridge incident, we spent a year's time on listening to views of different stakeholders, and we also try to make improvement in quality assurance. We listen to the views of the team, and we think this is really feasible. This can really help elderly persons, can enhance the quality of our CHEs. And we'd like to share some more views with you. Now, for money following the users, this is the rights principle because the choice can really be in the hands of elderly persons. Many elderly persons are now living in licensed homes. We give them choices. They can choose to receive higher quality service. We have also heard different views about the voucher. That is, at what levels should the voucher value be set? So we have decided to set it at EA1 level. That would be more appropriate. Why is that? We have to take a point into consideration. That is, the purpose of this scheme is to enhance the quality of different RCHEs. We provide an incentive. We want to encourage them to make improvement to their space and staffing arrangements. We have also heard the views of home operators. They also have their difficulties. So now it's set at EA1 level. We think it is an appropriate level because it is feasible. It is not unattainable. And also, we are using the present purchase price as a benchmark. So after detailed discussions, we find that this would be the appropriate level. So we are proposing the EA1 level, that is for the voucher value, but it doesn't mean that the RCHEs would just have to attain EA1 level. Many RCHEs can take part in this scheme. Many RCHEs are run by NGOs and they can also take part in the scheme. Many RCHE levels are actually above EA1 level. As I said just now, we are now introducing competition, so we want to encourage our CHEs to improve their service level. And thirdly, about quality assurance. As I said just now, after the Cambridge incident, I think we are all very concerned. The EC is also very concerned about this issue. So for the RCSV, it can help RCHEs to enhance their service level. And there is also one thing very important. We want to allow elderly persons to have the freedom to choose RCHEs. Now there are some elderly persons, in particular CSSA recipients, it's very difficult for them to choose RCHEs. They are limited. They have limited resources, and sometimes their family members don't know how to choose suitable RCHE. Just now, Dr. Chair said that now it is, well, a number of initiatives are proposed for making improvements. Free choice is very important, and that's another thing that is important, that is case management. This is a new initiative. So in the future, elderly persons and their family members would be receiving help when it comes to the choice of RCHEs. There will be professional social workers from the SWD who will be helping them. They will help the elderly persons to choose RCHEs, to monitor the service provided to the elderly persons in the RCHEs. And if the elderly persons do not like the home that he or she is living in, they can transfer the elderly person to another home. So the elderly persons would have complete choice. They would be living in RCHEs that they really like. So if we can really implement this RCSV scheme, there will be 5 tiers of monitoring. SWD's monitoring will be enhanced. Family members, elderly persons can also monitor the quality. Case managers will be monitoring, and also the community will also be monitoring. So the EC has the confidence to do this. When we implement the RCSV scheme, we will definitely improve the quality of RCHEs. So after reading the report, we think that this scheme is acceptable and feasible. The Secretary and the Permanent Secretary say that this is just one more choice. So now for our subsidized service, no matter whether it's residential care service or community service, they will continue. And the number of places will increase in the future. So the Elderly Commission endorses the report. Secretary, I would also like to say a few things. First of all, well, the government has taken careful consideration of the report. We agree with the EC, and the SWD will adopt measures to implement the pilot scheme. Our target is that by the fourth quarter of this year or the first quarter of next year, we will launch the first phase of the scheme, and it covers 250 places. And they are limited to the existing subsidized homes and contract homes. I would like to stress on several points. I think some organizations have reservations on the pilot scheme, but I hope to tell you that we are really trying to help elderly persons. I will address your concerns later. Point number one, as the chairman and the consultant team said, we are now giving elderly persons one more choice. It is just another choice, and this would not replace the existing RCS and CCS. This is very clear. Just one more path, one more choice. And we will not force elderly persons to choose RCS. We will definitely not force them to do so. And even though they join the scheme, there will be a trial period of 6 months. There is choice, there is flexibility. The right is in the hands of the elderly persons with respect to users. And the SWD will adopt a new measure, that is, case managers will be following up on the elderly persons. They will attach the most importance to the interests of elderly persons. And also quality assurance. After the Cambridge incident, we have been looking at this for quite some time. We wants to ensure the quality of our RCHEs so as to give confidence to people. So the confidence is very important. Now we have a mechanism. We will ensure that the mechanism is appropriate and efficient. We will monitor the quality of services. Well, a lot of members from the industry want us to adopt a case manager system. So now we are doing this. And also, we will look at the assets and income of the elderly person. We do not look at the assets and income of his or her household. So this is assessed on an individual basis. And also for the central waiting list, now many of the elderly persons on the list are living in non-subsidized homes. Some of them are CSSA recipients. If they choose the voucher instead of CSSA, then they would get a lot of benefits. Why is that? Because for the voucher value is pegged to the new service level, is not pegged to the CSSA rate. Now, now it's about $7,600. That is the CSSA rate for them. but for the voucher is $12,400. There are $500 more, so definitely there will be improvement. And also for the voucher value is totally paid by the government. Elderly persons can also apply for OAL, ANDA. And if they have rehabilitation needs, they can also apply for care subsidies. If they need special diets, they need diapers, they can apply for this care supplement. They can also be provided with a fee waiver for their public health care expenses, and they can also get full assistance under the Samaritan Fund and Community Care Fund Medical Assistance Program. The pilot scheme would not affect other subsidies. There will still be subsidized places. Some people are worried that the number of subsidized places will be reduced, but that will not happen. There will be new contract homes, and we also have another scheme in place, which is special scheme on privately owned sites for welfare users. There will also be 700 more places from 7 new homes. And now we also have 13 projects. This development projects, we have reserved sites in 13 development projects for providing an additional 1,400 RCS places. And for the special scheme on privately owned sites for welfare users, about 17,000 additional service places for persons with disabilities for the elderly will be provided, and about 7,000 of them will be for RCS. So we will continue to fight for more places. We understand that Hong Kong's population is aging very rapidly. Now each year 60,000 people would enter the age of 60. So we will be seeing many more elderly persons in the future. We need a lot of paths which are flexible to provide them with services. We would also safeguard the quality and sustainability of RCS. So other than providing one more choice, we also hope you would understand this.
There'll be 3 notes. That is, we will not replace the subsidized services. We won't. And the other note is that we won't force elderly people to use the vouchers. And thirdly, it will not affect our multi-pronged approach now. And there'll be a trial period. So that actually gives us the flexibility. And people who choose the vouchers, and there will be a case manager, and there will be appropriate monitoring mechanism. Whatever homes that are underperforming will take actions to target them. So, Chairman, that's the end of my introduction. Thank you, Secretary. So, following the order of your registration, I will invite deputation to speak. Each will have 3 minutes. The first is Mr. Lee, Coalition for Residential Care Homes. Thank you. The coalition thinks that to ensure that elderly people can age in place, we need to have a long-term social welfare policy and planning. And to address the issue of a severe shortage of residential care homes, there need to be adequate provision of care and good quality service. For this trial scheme of RCSV, we would like to supplement here. Based on the research, all the respondents polled, more than 90% of the elderly said they would not consider using the vouchers which required means test. So why? Is that why the administration still thinks there should be a means test? The coalition strongly opposes any kind of means test requirement for any provision of service. We propose that there should be a non-means test approach instead. and that the residential care homes should be provided on the basis of needs and maintain the unified charging system of care homes. And some dementia patients need to be given residential care homes because the elderly, the families can afford the challenge and the hardships involved. So I think the administration should consider letting dementia patients to use the voucher. And the research team also proposed that for level O users, once following assessment, they can be provided with supplements for caring. But this arrangement may not be appropriate for all. We propose that for all level users, the same subsidies should be provided. We need to learn from past examples. Well, these are SWD's money following user approach has actually resulted in elderly people not being given the due services they need. So since the government has reserved $800 million for the voucher scheme, the Alliance or our coalition hope that you can consider all the views in the report and also look after all the real demands and benefits of elderly people and come up with a people-oriented policy. Another supplement here, for the private land to be used for welfare services, you said there will be 1,700 places, service places or quotas. But some of the services requires matching. That is the seriously handicapped and also the shelter workshops with them actually take up one place. So in total, there will be less than 17,000. Thank you. Next one is Mr. Lau Lepchi. Thank you, Chairman. I want to point out for the voucher is a good idea, but before you launch it, the monitoring and whether you need to you have to consider whether there should be changes to regulations of private homes. You need to come up with a trial period to see whether any improvement is there. Because I think the monitoring of private homes isn't so good. Therefore, we see this Cambridge home case. So if there can be a trial period, and also after that, the elderly associations in the 18 districts think that the scheme is good and you can fully launch it. That's my view. Trial period, you mean the trial period for the residential care homes, not for elderly people, right? Yes. Okay. Next one is Cheung Kwan Ong Elderly Livelihood Concern Group, Mr. Kwong Wing Tai. Good morning. I'm from the Cheung Kwan Ong Elderly Livelihood Concern Group, Kwong Wing Tai. The government hasn't actually enhanced monitoring of quality, and yet now is launching the voucher scheme. I think this is a actually disgusting monster. It would not bring any benefits to the elderly people because the users will have to go through a means test, and also there will be 8 levels of payment, and there's also a rumor that people with CSSA payment of more than 7,000 and who are living in licensed homes, they are having much difficulties with their living. And therefore you want to raise the amount to 12,000 to save these people, elderly people. I think this is just one way thinking. I hope that the government can increase the amount by doubling it so that owners of licensed homes can ensure the government that they would actually double the quality of service. If that's the case, then the services for the elderly people will still be bad and the elderly residents will be tortured, and then the government will be wasting its resources and being manipulated by the licensed homes. At the same time, the residential care homes regulation since 1994 till now, it's been more than 20 years and the regulation has not been amended. Many regulations have been changed to keep up with times and should be changed, and yet there are loopholes in the current regulation. You know, personal safety is supposed to be protected by the regulation, and also elderly people living in residential homes can be safe and the family members will feel safe for them. And yet, what happened is to the contrary from what happened in the residential care homes in Taipo and the stripping of elderly residents in Cambridge, and to the recent case at the residential care homes in Tai Kok Tsui, where an old woman was tortured and suffered bodily harms. I think what happened really shocked people with conscience in the society. And what's worse is the elderly homes that tortured elderly people publicly said that they were operating in compliance with government regulations. So the regulation concerned has not been useful in protecting the elderly residents. Therefore, amending the residential care home regulation must be amended immediately. No matter what difficulties there are, you need to take the first step in amending it so that the elderly residents can be well protected and have a safe environment, and the families can feel safe as well. We don't want to have another insult to society. And also, civil groups once discussed the voucher idea with Dr. Lam of the Elderly Commission, and he said that without consensus they wouldn't approve the voucher scheme. And yet on June 7th, the Commission approved the voucher scheme, openly disregarding public opinions. Therefore, I will express my strong regret to the AEC. Next one is Ms. Mack. Thank you, Chairman. Because the EC ignores oppositions from the community and go ahead with in launching the voucher scheme, we express strong regret at that. I've got 3 points to make. Firstly, before launching the voucher scheme, you need to sort out the quality of residential care homes run privately. The media had reported a lot on torturing or abusing of residential care home residents, and the business people who run the private homes are in the business to make money. They want to maximize their profits. Therefore, they pay very little pay to their staff, who are forced to work long hours under long pressure. The workers, no matter how hard they tried, they would not finish all the work. Therefore, they vent their anger and frustrations on the residents. Therefore, we've seen so many cases of abuse of residents. And the businessmen shift the responsibility to their workers. They dare not face up their responsibility, and once they heard that the government is going to carry out inspections, they borrow staff from elsewhere to look after the residents, to cheat the inspectors. But who are these residents? They are the parents, grandparents of taxpayers. We keep paying tax, and yet the relative and family members are being abused. So this mentality of maximizing profits should be regulated. Otherwise, the quality will not be ensured, and also we should not launch the voucher scheme in a rush. And secondly, we also need to sort out the quality of the government inspection teams. I know the government has inspection teams, but it has little monitoring effect. People would give tip-offs to the homes on when visits or random checks will be carried out. And then they will just the staff concerned will only provide to the superiors the number of inspections and number of people doing inspections. That's it. I think you can see that from press reports, and that will not help improve quality. So before the government has enhanced the quality of monitoring, you should not launch the voucher scheme so soon. And thirdly, we need to amend the law and strictly enforce the law. Government officials have said that if the law enforcement is too stringent, then there could be closure of private homes, and the elderly people would be forced to live on the streets. But I don't think that's substantiated. Why does the government buy places? Because the residence rate at private homes is only 70%. So there is still a 30% of non-occupancy rate. If you have better quality, then the residents can have better care. I don't think the homes would close. It's just that they don't need to maximize the profits. They can use part of the profits to improve services, and then they can keep operating. If they close, then they will have no profits to make at all. And yet, if they improve services, they can continue to make profits on a continuous basis. Enforcing the law strictly is a way to ensure that the operators will carry out proper services. Thank you. Next one is Wang Yuntat from Workers' Neighborhood. I remember in April, after Dr. Lam took up the post, he met with many of our associations and we expressed to him our worries and concerns. We told him we don't want to see the voucher scheme passed. We asked him to carry out more consultations in the 18 districts. But I find it regretful that on June 7, the voucher scheme was endorsed. I know that he has suggested there have been amendments, but if you are making amendments in a good direction, why don't you carry out more consultation and get more opinions first before going ahead? I can see from the report that the number of people who are willing to join the scheme is only about 10%. So why, if there's room for improvement, why don't you carry out more consultation, get more support and involvement first, and to get more opinions for your consideration before launching it? I think you can really do more and to enhance the scheme instead of just going ahead with it. And secondly, as for the means test, for families and individuals, of course, there are good things about it, but the ultimate purpose is to make the elderly people bear more of the cost. But for residential care home users, the people going there, they would not have much access. So why do you force them to have a means test? Is it that the government don't want to bear the financial responsibilities? If that's the case, so as a coalition representative said, why don't you remove the means test so that the elderly people could be less worried? And also, more importantly, is that you have to have good monitoring. The Secretary said there can be 5 levels of monitoring. But whether you can have good monitoring, I'm worried. The most important is you need to have the random checks or visits by SWT, because in the homes, the elderly people may not be able to recognize for themselves how good the quality is. They don't even know how to compare services. They haven't been to many homes. How can they compare which is better? They may think that, well, all homes are similar. And the elderly residents may not want to move from one home to another because to them it's very troublesome. So you need to consider, if you want them to move, well, they don't really want to, but that's why we need to have good random checks by SWT. We've been to some homes ourselves. We can see the big difference between subsidized and private homes, but which have violated the law, regulations, and so forth. I think we laymen can know very little, and we cannot play the monitoring role. So you need to amend the regulations to increase the penalties and step up monitoring. That's more appropriate. Okay, thank you. Next one is Mr. Chen Liangqi. Thank you, Chairman. I'd like to say that Dr. Lam Ching-choi of the EC and other EC members have violated the when we met with him on April 20th, the pledge that he made to us during our meetings with various elderly organizations on that day. We have actually, through our work, met with various elderly people, and they said that each voucher will have a value of 12,000. They were very pleased with it. They thought that the voucher could, like the healthcare voucher, subsidize their accommodation in a residential care home. But indeed, in fact, the users will need to go through a means test, and also their personal asset should not exceed a limit. Then they can qualify for level O full subsidy. And also the residents or other people who actually have excessive assets will have to pay several $1,000s in payment. So don't you think the elderly people need to save money to look after the funeral services later on? From thousands to, if you're not going to subsidize from thousands to more than $10,000 in payment of residential care, then please don't lie to them. I think the services in the private residential homes is something that elderly people don't have confidence in. I think the EC needs to amend and review the residential care homes regulation to improve services. And yet now you are asking the SWT to hire case managers to follow up on services and monitor the services provided by the monitored homes. And the manager needs to look at the budgets and also carry out the monitoring role. I think that would make things difficult for the case managers. Do you think that the case management model will work? There's no guarantee, indeed. Elderly people are not guinea pigs. Please don't underestimate each life. Last week, I was talking to an elderly resident, telling him that the voucher scheme has been approved. He told me that he had not have any expectation for the government as long as he can eat or walk, and he would rather die early instead of going to a private residential home. So what sorts of elderly services policy do we have that really cause our elderly people to want to die early than rest in peace? In a developed city like Hong Kong, why can't we actually provide choices of good quality homes for our elderly who've contributed their whole lives to Hong Kong? Why can't you cut down the number on the waiting list? And why is that without public consultation you work in the black box and launch the voucher scheme secretly? Dr. Lam Ching Choi, I don't know what a pledge means to you, but to elderly people and the carers, honoring a pledge is, pledge is lifelong, and honoring it is important. I hope that the EC can honor your pledge and withdraw the voucher scheme. Next one is the Hong Kong Christian Service, Ms. Tan Pui Fan. Ms. Tan, thank you, Chairman. In March this year, elderly people from our group said this here, that we elderly people are very worried that officials will be doing something bad with a good intention. I'd like to say that we are very angry because on April 20th, in the CGO next door, we met with the Dr. Lam Ching Choi, the head of EC, and other officials and other consultants. Together we discussed the issue related to the voucher scheme. At the end of the meeting,
Dr. Lam promised that he would be going to the districts to listen to our views, and there will be a proper meeting to follow up. But then on the 7th of June, surreptitiously, the Elderly Commission approved the scheme. So what do you take us elderly people for? So we strongly urge that the residential homes ordinance be improved first. There should be better monitoring, and the penalties are too light, and we have more and more incidents, and you just keep saying that there will be improvements after the Cambridge case, and then there's another case in Tai Kok Tsui where the elderly residents were tied up. So how can we rest assured about the authorities' determination to make improvements? And there should be no difference between RCV and a CCS. Because much would depend on the physical conditions of the elderly. There should not be two queues. You should not ask the elderly people to choose one queue, and if they decide to join the other queue, they have to line up again. And we should allow every elderly person a choice. And it's also suggested that the user has to give up CSSA after 6 months. And it said that there will be flexible subsidies and there will be other funds to take care of the welfare of the elderly persons. But can they really have access to so many different subsidies? Well, we have our worries. And there's only a quota of 3,000. What about the one after the first 3,000, the second one? And I also have a question about for the officials and for the consultant. Every time you come here, you listen to us, elderly people, and also people working in the field of elderly care. and they will be telling you about the mistreatment that they have got. Well, this is heart-rending. Elderly people and their families don't want to see such cases. So why are you talking about improvement on the one hand, and you want to launch new schemes on the other? Chairman, please ask the officials and the consultants to give us proper answers. What do you feel about those cases of abuse? Chairman, I'll give them some time for answers. Ms. Chan Sun Yi. Well, we oppose to the proposal to launch the RCSV scheme, and we reject to the lack of transparency. Well, we had a dialogue with the officials. Apart from Mr. Matthew Cheung, all the other officials were there. Dr. Lam Ching Choi, you promised that there would be a follow-up meeting and there would be local consultation, but you didn't do anything of that. And then on the 7th of June, you approved this RCSV scheme. You have cheated the elderly people. Do you have any conscience? Do you have any sense of shame? We don't recognize this procedure. Dr. Lam Ching Choi, you should honor your pledge. You should do consultation locally in the districts. And the RCSV is not able to improve service quality. And many private homes are charging excessive fees, and they are abusing their residents. But the LWB and the SWD and the Elderly Commission are not faced up to the core problems. The Cambridge incident is a trigger. You should review the outdated residential care homes ordinance. You talk about the choice given by RCSV is a sugar-coated poison because you're not going to improve quality. It said that the voucher scheme can help those on CSSA. At present, in a subvented home, the fee will cover service by doctors and physiotherapists and the like, but the voucher scheme will not. And now you want them to join just one queue. And the OAA will not be able to cover the cost of these services. So are you asking the elderly people to use their savings, and they will not have a good retirement life? You officials work in air-conditioned offices. You have ignored the plight of the elderly people. The abuse cases point to the need to long-term planning. Over the years, you haven't done any proper planning. You just want to introduce a voucher scheme to reduce the waiting list. Well, there should be no means test because it's an entitlement, just like other rights. So we strongly urge the government to cancel the RCS voucher scheme. Mr. Lui Tin Yan, we support the principle of money following the user. We understand that by adopting this scheme, the choice rests with the elderly person concerned. But if this is only confined to A1, this would mean that the elderly persons have fewer choices. The choice is limited. For A2 and also other licensed homes, and many of them are of good quality, and the operators are good operators. The government should not just adopt A1 standards in implementing the money follow the user principle. And you will not even allow an A1 home to participate if it has received 3 warning letters previously. For the non-portraits homes and A2 homes, you can adopt as the same criterion. That is, if they have not received 3 warning letters previously, they should be allowed to participate in the LCS voucher scheme. Because if it's restricted to A1 homes, then there's not much choice. And the discrepancy in service quality has to do with manpower. It's difficult to hire good staff. If you look at the problems, the case with Cambridge Homes, very often it has to do with the service quality of frontline staff. At present, the medicines are dispensed by a nurse or by a qualified worker. It would not be fair if there's a mistake committed by the worker. Because the warning letter is sent to the operator. And there are many problems with the monitoring system. I propose that we provide a special grant to frontline workers to increase their minimum pay, so that we can have more people and we can hire more people and service quality can be improved.
跟住呢，就係全港私營安老院。
Thank you. Mr. Kwong Wai Peng is from the Hong Kong privately run Residential Care Homes Association. Well, many deputations have offered comments on the service quality of homes and the monitoring system. But is it true that by stepping up monitoring, we can improve service quality? Well, because it's a people-oriented operation. If we don't have quality staff, how can we offer quality residential homes? And many the wardens of homes are not properly trained, and there's no policy requiring wardens to be trained. If someone who is not knowledgeable about homes, how can you expect good management? And some of the wardens move up the progression ladder, starting as a frontline worker, and they only follow old practices. So we would like to stress that the people or staff and workers should be properly trained, wardens too, and this would be the first step towards service improvement. Otherwise, just by stepping up monitoring, you can't achieve much. I have conducted a survey covering 41 homes. I asked them about the number of assistants and workers. They have 206 assistants, 471 workers, and 48% of the assistants are those they want to replace, and many of the workers will face a replacement if it can be done. Because if they do something wrong, the home operator will be prosecuted. If these these workers are not good workers, how can we improve service? For example, if someone doesn't want to change diapers for the residents, and the operator allows that the other worker will ask for a higher pay because that's what they would be required to do in their stead. And it's also for A1 criteria, well, it's a requirement of SWD. We need to be assessed by SWD. But how do you assess a home to be a A1 standards if they are not under the bought place scheme? There's a pilot scheme of Hong Kong U. Out of the 139 homes, 41 would like to be involved in the voucher scheme. These are not bought place homes. It's said that through the bought place scheme, the service quality can be enhanced. But those who are not covered by the bought place schemes, then how can they enhance their service quality and grading? So how do you assess the risks with these homes, and how can you maintain sustained improvement in these homes which are not covered by the bought place scheme? Mr. Wong Chong Kwan from the Social Workers Union. The RCSV system would mean that the elderly people would not be able to get a good service. According to the PAC report, the average space is 99.9 meters in A1 homes, although it's higher than 6.5 meters for PRH and 9.5. But it's much lower than the subvendor homes. And when you are not able to enhance the space entitlement with $12,000 of grant, if the elders have to live in crowded homes, the living quality will be affected. And the staffing ratio is 2.6. Although it's much better than 1 to 60, but it's much worse than 2 to 40. The nursing staff is not in line with the SWD. After the introduction to the voucher scheme, the service provider would receive $12,000. And then how can they improve the service to go beyond the A1 standards? Or would the government just turn a blind eye, and by adopting the money following the user scheme, there will be no improvement? So the first thing to do is not to introduce a voucher scheme, but to amend the laws which has not been amended for 20 years. In other countries, they have much better staffing establishment and a space entitlement. For example, 10 meters in Japan, and in Taiwan, the nursing staff ratio is 1 to 20. Hong Kong is an affluent society. We should not lag behind, and the government should not take the lead to ignore the well-being of elderly people. There should be more subvendor places. But according to the Secretary, to 2016, 2017 to 2018, 2020, there will be just 100, and there were 13 projects which will be able to provide 1,400 contract places. And also for the special scheme for welfare users projects, there will only be 7,000 places. So simple arithmetic can tell you that we cannot cope with the waiting list of 30,000 elderly persons for subvendor places. So the government is very inefficient. We should enhance community care so as to delay the need to admit these elderly persons in homes. So the $800 million for the RCS voucher scheme should be turned into CCS vouchers. Thank you. Ms. Lee Fai. we represent 90% of private residential homes for the elderly. We welcome the adoption of the experts' report by the Elderly Commission, and I thank the Secretary for a very detailed explanation. We know the voucher scheme will be implemented in phase. And what is even more reassuring is that there is a trial period. There will be case managers, and these case managers will be professional social workers of the SWD, which would instill a lot of confidence in users. I've listened to other deputations who have talked about problems about private homes. Ms. Yip, who has left, she said that the homes will be tipped off when the SWD does inspection. Well, I'm angry every time I hear allegations like this. If you have evidence, you should report the case to the ICAC. So why can they repeat these half-truths and lies again and again? And many NGOs have rely on absurd grounds to oppose the RCS voucher scheme. They say that the government has treated the elderly as guinea pigs. Why is it that the voucher value of $1,200 and there are 4,600 A1 home places which are being offered? Why do you think that elderly people will be turned into guinea pigs by introducing a new voucher scheme? And the scheme would also allow their families to top up the cost so that a better service can be secured. This is a co-payment approach, and it will represent the best utilization of government funds. So what's so bad about that? Well, some service providers just want to remain in their comfort zone. They don't want to try anything new. And with the existing homes do not have sufficient places to meet the demand. So we must find some way and set clear criteria to cope with the aging population. They should not try to stop things from happening. It's just like the filibuster in this council. I think it's irresponsible to try to protect one's vested interests.
Next, elderly service allowance, Mr. Law Wai Kai. Chairman, the government is going to launch LCSV soon, and is for EA1 homes, contract homes, and self-financing homes. Well, many elderly persons welcome the scheme because only LCHEs that are up to a certain quality can take part in the scheme. However, this means limited choice for elderly persons. For EA1 homes, the quality is different from subsidized homes. And how about private homes? In Hong Kong now there are 550 private homes, and about 40,000 elderly persons are living in them. Most of them are frail. They have been hospitalized and then they were discharged, but when they go home, no family members can take care of them because of the physical condition of these elderly persons. They have to be institutionalized. A private home is the first safety net because they are not on the central waiting list. They have to enter homes immediately, so they have to use their CSSA to go into private homes, and they are on CSSAs. Private homes would charge 80% of the inmates at $6,000. So for the rate you suggested is not enough. That's why we keep on saying that there is a huge quality gap between subsidized homes and private homes. And the reason lies right here. For RCSV, it is an opportunity to enhance the service quality of private homes, because with income, private homes can improve their quality. And if they have good quality, then more elderly persons would be willing to live in them. And with higher income, such homes can improve their service. And then elderly persons would have better choices. They won't just rely on CSSA to be institutionalized. I think this is also the goal of the SWD. Thank you. Next, Hong Kong Social Worker Union. Mr. Yip Kin Chong. I'm also in elderly service. I know a lot of social workers who are in this field. Many of them don't think the quality of private homes are good. When they have no other choice, private home is their last resort. We object to the LCSV scheme because, for the value, because of the value, EA1 homes will become the standard, and the service standard will drop. And there will only be a 6-month trial period. After 6 months, there will be no case manager, and the elderly persons cannot move to another home. And also, the space they are entitled would be dropped by 50%. The government always thinks that a market mechanism is omnipotent. They think that with the intervention of the market, all the problems can be resolved. However, we do not have a complete competition law. Can the market handle all these problems? I am really suspicious. We think that the market mechanism can solve all the problems. However, eventually, the market will be taken over by conglomerates and SMEs will be gone. Then we will not be able to address the problems of elderly persons. The link route is a very good example. Now the government is passing the buck to the market. This is not right. The qualities of homes are different. The sanctions against RCHEs is not deterrent enough. So we have seen many cases of elderly being abused, and the family members are very worried. The ordinance governing RCHEs was enacted in 1994 is really outdated. The government cannot ensure the quality of private homes, and it doesn't have a timetable for increasing RCS places. Now it's passing the buck to the private market. This does not help the people. And also the government is introducing a means test. Elderly persons and their family members will be subject to different charges from RCHEs. We are very unhappy with the government's decision. The government has earmarked an amount of $800 million for the LCSV scheme. We ask the government to spend this money in a wiser area. So the $800 million should be used to improve the existing services. Next, Ms. Lam Yue Kiu. I have heard the reports from the government officials and the Elderly Commission. I have several questions for them. Just now you mentioned level 0, The consultants and the governments both said that if they have healthcare needs and daily necessity needs, they can apply for supplements. So what is the source of what's the financial source of the supplements? Would you be setting up a new elderly commission? Where does the money come from? Because at present we do not have this policy. That is for non-CSSA recipients, you are giving them supplements. This does not exist at the moment. So where does the money come from? Can you give us an explanation later? And secondly, for the 6-month trial period, after that, can the elderly persons move to another RCHE? Well, within the 6 months they can do that. The case manager would help them. But how about after 6 months? If not, then what is meant by money following the user? Because the user doesn't move. So the vouchers will be given to the RCHE that they are living in at the moment. And also for case managers, the SWT will be providing case managers. So how are you going to train the case managers and what's their workload? Because this will directly impact on their service quality. And how are you going to monitor the case managers? And fourthly, you talked about the 5-tier monitoring. The government asked the consultant to look at this again and now is making another recommendation. At the community level, there is a service quality group. And what is that? Can you tell us more details? Who are involved? And how is the monitoring to be conducted? And also for the RCSV, it means a major change in the government's subsidy policy. Now the government will be providing $12,000 to each elderly person, but there is a means test. So there is a range. It's from $3,000 to $12,000. This is a major change to the government's subsidy policy. The government is actually reducing subsidy. And also for subvented homes, they have the service quality, and now you are lowering it to the EA1 level, both in terms of staffing and space. So this is a major change. The government shouldn't make such a change only because of a consultant's report. You should conduct a public consultation. Next, Mr. Kunsilman. The government doesn't know how to take care of elderly. This is not something new. You are trying to launch this scheme. It sounds good, and you are going to give out 3,000 vouchers. However, I think the devil is in the details. Now, there are 31,000 elderly people waiting on the list. They have to wait for several years, and each year 5,000 of them would pass away. For private homes, they account for 70% of the total service. So how come elderly persons are not using private homes? How come they are still staying in the central waiting list? Because for the service of private homes, the quality varies. For example, it's disclosed that in Taipo, Cambridge homes took off elderly persons' clothes and asked them to wait in open air for their turn to take a bath. And we have also heard that some elderly homes are abusing the elderly inmates. So their services are very different. Some of the services can be very poor. This is because that they do not have enough manpower. So some of the staff are forced to do extra work. They are under huge pressure and they vent their anger on the elderly persons. I don't think the RCSV scheme will be supported by elderly persons and their family members. This is not feasible. And you also suggest a means test. It's the same as the universal retirement protection. do you have conscience? You impose a means test on these people. So, and also, if elderly persons opt for voucher, they cannot receive CSSA anymore. So I would like to ask the government, when you launch this scheme, have you considered the expenses of the elderly? Have you considered their feelings? And for private homes, their services are very different. If in the short term, the government cannot solve the problem of the serious shortage of RCHEs, then why do you want to spend $800 million on this? I want to ask Matthew Cheung. In 2016 to 17, there will only be 998 new places, and you still have 30,000 people on the waiting list. You're spending $800 million on this scheme. So why don't you just directly increase the number of places? Where are the difficulties? Next, Mr. Chen Yong Chao. Our organization supports the LCSV scheme. For LCSV, resources can be more evenly distributed in the market, and the service for elderly can be improved. We need more quality places so that the waiting time can be shortened. Without the LCSV, when we take care of elderly persons, there are 3 tiers. First tier, subvented homes. The budget is $19,000. And second, enhanced board place system. They are also taking care of elderly. And thirdly, CSSA recipients, for those who are receiving $6,000, $7,000, they are also being taken care of in homes. They are all elderly persons in Hong Kong. So if you are more affluent, you can be placed more properly and faster. Because there is this 3-tier system. So some elderly persons would have to live in private homes for 3 or 4 years waiting for subsidized places, and some of them pass away before getting into subsidized places. So it is not fair. The RCSV can solve this problem to a certain extent, because this will promote competition in the market, and RCHEs can improve their quality. For CSSA recipients, they will no longer be subject to the limitation of the CSSA system. And also, you talked about co-payment. This is a new measure. For operators and home carers, the purchasing power can be enhanced, and LCHEs will be incentivized to improve the quality and hire more staff so as to attract customers. There are homes that are taking care of CSSA recipients, and the rate is $6,000 to $7,000. It is impossible for them to provide quality service at such a rate. The elderly persons in the future will become purchasers, and there will be more competition in the market, thus improvement. This is a rule. Mr. Loko Yang from non-subsidized RCHE Association. We support the proposal of RCSV. It's very simple, because with RCSV, elderly persons can have their own choice. As for non-purchased as well, RCHEs with non-purchased places, we're actually taking care of the most needy elderly persons. So where can these elderly persons go? If it is urgent, well, they go to private homes. We represent 70% of the market. So are we representative? What kind of rates are we charging? If you do not give LCSVs to the elderly persons, would that be fair and just? Because these elderly persons do not have a lot of means. So you want to deprive them of their choices? Well, on the mainland, now is socialism. So do you still want to talk about communism now? We have limited resources, so we should give the resources to the most needy grassroots people. Don't always think about subvented homes. You want the government to build more subvented homes? It's a very long way. Many elderly persons would pass away before these homes are built. Please wake up. We know that there are only limited social resources. And how much resources are we taking from the market, and how much services are we providing? We are not fighting for resources with you. We are talking about providing service to elderly persons. You don't have to pay, and then you can get free lunch. But how many free lunches can you enjoy? After 2 free lunches, you'll be driven away. How many people can continue to provide free lunch forever? It is not possible. Chairman Lam says this is feasible. He says that this can be implemented. So we really want to try it out. We will definitely try to provide good service. So I hope that with these different batches, we will continue to provide better and better services. Hong Kong's private hospitals have resources. Many of them are better than public hospitals in Hong Kong. This is a fact. All the best doctors are working for private hospitals. Thank you.
Next one is the Improving Public Places Scheme Select Group, Mr. Ng. On behalf of the Improving Public Places Scheme Select Group, I would say that we support the government's money follows the user principle. The government's policy actually can enhance the quality of private homes to raise from EA1 to EA2 level. There needs to be an increase in care services, and there needs to be also more residential care homes applying to upgrade their level to provide better quality services. Those who are on the waiting list need about 3 years to be given a place. And during a period, quite a number of elderly people may suffer a stroke or fall and require emergency care and attention places. And the subsidized homes will not be able to provide immediate places. At that time, the voucher would be come to the rescue of the elderly people. The voucher scheme has long-term benefits to the elderly people and the society in terms of monitoring. We very much welcome elderly people and the Secretary and Dr. Lam's proposal to have the case management system. And the sector is that we also enhance our monitoring, self-monitoring, and to ensure quality in services to protect elderly people's rights. Based on 2015-16 information, it is the subsidy for subsidized homes went to $99 million. Considering the zero cost of subsidized homes, the EA1 level homes actually are using the subsidy to provide horses, to provide services at 80 to 90% of the subsidized homes. I hope that the government can continue to invest resources in enhancing the quality of EA1 level homes. I believe that EA1 homes can exceed subsidized homes in terms of quality later on. As for the grace period, the money follows the user principle can enhance, give people a period to improve the services, and the 6-month grace period for elderly people can allow them to choose where to stay in the home or go back to the central waiting list. And this arrangement can also be flexible and make elderly people benefit from the scheme. And yet elderly people in their subsidized homes will not have a choice. Even if they cannot get used to the environment, they just have to bear with it silently. I think that's contrary to the principle of having people-oriented policy. Therefore, I support launching this scheme as soon as possible and enhancing the quality of or causing EA1 homes to upgrade the service. Next one is Wong Ka-chung. Good morning. I'm from the Association to Enhance Homes for the Elderly. We've talked about the voucher scheme for more than 10 years. People who were back in 10 years ago who were 65 and now almost 80. And the government consultants has finished their report now, and I don't know what more study the government needs to do when we can really actually have the voucher scheme. If it takes 1 or 2 more years to carry out further study, then the 65-year-olds 10 years who were 65 years or 10 years ago may not be on earth by then. So I really hope that the government can see that the elderly people cannot live that long. So the voucher scheme is very much a welcome initiative. Like the healthcare voucher, elderly people can choose which clinic to go to, which doctor to go to. It's their choice. You are the boss only if you have the choices. Elderly people with the voucher can be a boss. Because they have the voucher in hand, they can choose the right home for themselves. In terms of location, environment, and so forth, they can make the choice. If the service is not good, then they can choose another one. Just then the Secretary said there is a trial period and there will be a set of measures. If a home wants to retain the elderly residents, they will need to improve the services. And that will provide an incentive for homes to improve the services. And the government will also carry out their own monitoring mechanism. I don't see why there are still people who try all means to stop the implementation of this policy. Maybe it's because of the curtailment of their own interests. Therefore, they try all means to stop the implementation of this policy. Let us reiterate. You need to give back the choice of choosing the homes to the elderly people. I think just by relying on the government or any party, we cannot resolve this issue of aging population. I hope that the government's policy can let elderly people choose their circle, choose their community, social circle, and so forth. So we do support, our association support the voucher scheme so that all eligible homes can participate in it. As long as the homes meet the government's requirements and that there is fair competition, that's fine. We and elderly people would support totally the voucher scheme. I will urge the government to implement this policy beneficial to elderly people ASAP. Don't delay any further, otherwise the elderly people will die. Next one is Lam Chung Yao. First of all, I'd like to point out that the chairman of EC, Dr. Lam Ching Choi, and those who supported the voucher scheme on June 7th, you have violated the decision or the promise made to elderly associations at a meeting on April 20th. You had not followed up on issues raised at that meeting. You owe us an explanation. People will chase you for an explanation and hold you accountable for that. People wonder there are a lot of issues surrounding the voucher scheme. Even for the addition of 1 assistant director scheme and also increase of an additional 39 posts in the licensing office, and also to change the per capita space and the staffing at EA1 level as the basis for running the home. I think those are still issues. And also for the per capita space and also staff resident ratio, they are totally actually not in line with what's expected in the private sector. The more places cannot really meet the needs of elderly people. The Social Welfare Department says that every year they have inspected private homes 5,000 times a year, and for each home there are at least 7 inspections. But why is that we cannot stop the series of abuse of elderly people? The inspectors only check documents mainly. It turned out they did not really look at the services and arrangement for providing care, and they did not listen to grievances from elderly residents. And when they discover problems, they only give verbal warnings. And the penalties concerned only are fines mainly. So the home concerned, the home operator in question could apply for new home using a new name. So even if you are to increase the number of inspections and manpower, I don't think you can really achieve a deterring effect and also enhance the quality. We urge that you should amend the residential care home ordinance to stipulate that there will be certain penalties, fixed penalties for people abusing elderly people. We need to achieve enough deterring effect. And secondly, you need to enhance the manpower ratio, per capita space, and operational model in private homes so that they can meet the levels of homes with box places and subsidized homes. The subsidized amount should also be enough to help homes reach the standards of private and subsidized homes. And also you need to look or revisit the guidelines for inspections. Apart from increasing the number of inspections, you should also step up contacts with families of the residential homes residents, and also you need to find out more about the actual living environment of the residents. When there's so many worries and dissatisfaction with the services, you should not launch the voucher scheme now immediately, because that would be an unwise move. Thank you. Next, please. Thank you. Good morning. I need to say to Dr. Lam Ching Choi, Chairman of Elderly Commission, and all those who attended the meeting on April 20th, and also the members who voted in support of the voucher scheme on the June 7 EC Commission meeting, I'd like to condemn them. They have actually lost the confidence of partner groups and elderly residents. I suggest that Dr. Lam Ching Choi and those who supported the endorsement of the report resign in total and to be held accountable. Being cared for at home, of course, is the hope of elderly people, and it's also an indicator of quality living. The ratio of elderly residents moving into residential homes is up to 7%, which is the highest worldwide. So you can see that well, the reality is we're not really addressing the core issue. The institutional care is really not a backup as mentioned by the government. By the end of May, long-term care, those who require long-term care on the central waiting list, number 6,226. And they're actually waiting for all sorts of community care service as well. You need to wait for 3-4 years for home care, and also there's a long waiting queue for home meal delivery. And even for those who are given the meal delivery service, they can only be given the meals 3 to 5 days a week. Now, with more 3 times increase in the number of elderly people requiring need, the subsidy has not increased. I think in terms of the community care or the home care services have increased many times. And now the government is going to spend $800 million to support the voucher scheme. The Audit Commission has said that the box place scheme over the past 2 years have empty places of up to 250, and there are some homes with less than 50% of usage rate. Actually, it found that only about 10% of elderly people would like to have residential care services. So you can see that how ridiculous the system is. You say that you want to encourage elderly people to age in place, and yet your care and detention services lag behind the actual need. And what's more ridiculous is that you want to say that you're going ahead with the voucher scheme, yet only 10% said they will want to use it. And you're going to get them to stay in private homes with inferior services. So you are encouraging or giving incentives to homes which are providing substandard services. You are not just giving you're not encouraging elder people to choose a home or to be given place in a home that is familiar to them, that they like, where they can find their own circles. And I think you're only giving services to those who are severely or moderately impaired. In the long run, the resources for long-term care will only decline rather than be increased. Thank you. Next one, please. First of all, on Dr. Lam of the EC, he had promised to listen to views in the communities, and yet on June 7, he endorsed the voucher scheme. I express strong regret at that. Back to this topic of voucher scheme. I think people who are in residential care homes had no choice but go to private homes. And many of them, they are the one with the least support network. And for some, well, there's some extreme cases, but today I want to talk about the average quality of living in those homes. In 2010, the Social Work Department of Baptist U carried out a study on the quality of private homes. It reflected that the survey found that 70% of the homes residents were not satisfied with the environment and facilities of the homes. They felt disrespected by the staff, and they didn't like the attitudes of the staff, and they didn't enjoy the company of the fellow residents. With limited residents and also for the sake of profits, the care and attention were only provided were only limited. And there is also a rigid timetable for the elderly residents for the convenience of the shifts of the carers. Well, there's supposed to be 4 meals given to the residents from 7 a.m. to 6 p.m. 6, they will have the dinner, and the next day, that means the time there will be a lack of 10 hours between the dinner and the meal the next day. So many residents have to bear with hunger, waiting for the next meal on the next morning. And there are also fixed times for the residents to change diapers, so they are stuck with dirty diapers, some of the residents, for some time. And therefore, some residents have skin diseases. For visitors, talks, or outings, most homes could not organize even one of them every month. So residents, once they are placed in the residential home, they became stuck in the home, and their mental health is also deteriorating. So institutional care is not the top option or the priority option for residents. And now Hong Kong, with a 7% usage rate of institutional care, I think that's really the highest worldwide. And now the government is actually trying to enlarge the share of the market. And I've got 3 questions here for the government. I hope the government can answer them. Residential care home policy, is it really oriented towards elderly people aging in place? Or is it running contrary to your care and attention policy? And I think the voucher scheme has not yet convinced the public. And what are the reports does the government have that can convince the public to accept the voucher scheme? And also the voucher scheme could also trigger private homes to increase their fees. How can the government ensure that the subsidized homes or the places would actually bring benefits to the residents? Next one is a Mr. Poon, Dr. Poon from a study group. On behalf of our special group on elderly policies, we would support the Dr. Lam's commission and its proposal to implement the voucher scheme. In response to a speaker, Mr. Chang's point, who cited the example of link rate, but let us look at it from another perspective. Let's look at the positive sides of the market. When you go to link-run markets, you find that the environment of the link markets, compared to the times when they were run by the housing department, well, the environment is better, it's cleaner, and the markets are air-conditioned. In our discussions with Link, when we rented their premises and shops, I think compared to our discussions with housing department before, the efficiency is much higher now. Of course, rentals go up and wages go up, and the economy can improve. If the economy doesn't improve, how can we have the resources to look after the old? You know that the quality of private homes vary. I know the example of the Cambridge homes is one incident. I used to work in a public hospital's emergency accident ward, and I could see that there were many cases that were referred from subsidized homes, and the patients admitted from those homes, they had some bone fractures or some bruises on their bodies. So whether it's subsidized homes or private homes, there were individual cases or of accidents. So please don't target particular homes, like private homes. And the voucher scheme itself has the main purpose of resolving the problem of CSSA recipients living in subsidized homes. Once they've got the voucher scheme, they will have an additional $5,000 in subsidy, and the money can be used by homes to improve their services and quality of services. And I believe that if for residents, CSSA recipients in private homes, which number more than 3,000, if they all move to subsidized homes, let's look at the money and manpower. I think it will be a big problem just looking for the premises to accommodate them. I just want to supplement as well that every year the government, in spending on care for the elderly people, it reached $6.2 billion. $62 billion, making up 1/5 of the welfare budget. If we want to make sure that each elderly resident have a personal space of 25 square meters and 1:20 of nursing ratio, I think that would double the expenditure on the elderly. And where does the money come from? Are we going to get the money from more taxes paid? So we need to consider that. Thank you. Next one is Concern Group for Family Care Alliance, Ms. Zhang. Our alliance on loan has actually expressed dissatisfaction at public hearings or in marches or at the meeting on April 20, expressed our dissatisfaction. But unfortunately, the government has not addressed our concern and eased elderly residents' worries. Therefore, our alliance had issued a regret statement. We said that the government has ignored public opinions that have not addressed elderly residents' concerns, and yet the EC endorsed the voucher scheme. On June 7th, the AEC accepted a report made by the Hong Kong U team, and the Secretary for Welfare, Matthew Cheung, Saturday will set a timetable to launch the voucher scheme. We express strong regret that since last year there have been much voices against the situation of long-term care for elderly people, particularly the quality and monitoring of private homes. Many elderly people and concern groups have unanimously voted against the voucher scheme, and also sending elderly people to private homes, disregarding the issues with those homes. The Bureau and the EC had collected lots of opinions against private homes, and yet you have not provided any solution to those issues. As for the EC's emphasis on the report by the consultancy team,
對反對推行院舍
and EC ignore the opposing views, and all the concerned groups and stakeholders are very unhappy about this. The elderly care policy is inadequate. Many elderly persons are forced to go to residential homes because of their physical conditions, and some of them are forced to go to the private homes with a questionable service quality. The elderly and their families have no choice, and they can only wait for subsidized homes indefinitely. And on the other hand, the government has failed to address the problems of insufficient service provisions. and they are now treating the elderly people as guinea pigs. All they want to do is to cut the waiting time or to cut short the waiting list and ignore the dignity of elderly people. My alliance expresses the deepest regret about this. My alliance has asked the government to retract the voucher scheme and to do the consultation again. Next, we have Elderly Association, Mr. Ho Peng Chiu. We should not ignore the voices of home operators. We would like to say clearly that we oppose to the RCS voucher scheme. In 2013-2014, according to a report, the expenditure on community care was $910 million, and recently $800 million has been set aside for the implementation of the voucher scheme. What about using the $800 million for the community care instead? Starting from 2009, the place has increased from 7,060 to 9,450 in 2014, an increase of 35%. And the waiting time for community care has increased by 84% from 2,330 to 4,280 cases. Daycare service requires a waiting time of 8.5 months and 3.5 months. The average waiting time is rather long, in some cases more than 1 year. I hope the government would redeploy the $800 million to to reduce the waiting time for the daycare, community care in the NT to 1 month. This would prevent elderly people from getting admission to the elderly homes prematurely. The waiting time is long. It's almost 10 months. We hope the waiting time for the outreach home service can be reduced to 1 month. This is to prevent premature admission of elderly people to residential homes. In the survey conducted in 2002, improving the community care services and the home care services, especially for those who would like to stay with their family members, can be improved. Thank you. Mr. Feng from the Alliance for the Elderly. I would like to point out that the consultants and also the EC's public consultation is fake consultation. At this stage, we are opposed to the pilot scheme on RCS voucher for the elderly. We see no future. We don't know what would happen to the residential care service. The government, the EC, and the consultants have failed to publish the latest consultancy report, there is insufficient information for the elderly to have an informed discussion. And now they are coming to this council as a matter of formality. We oppose to the proposal to launch the pilot scheme, given that there has been insufficient discussion. The EC has failed to provide an effective channel for the public and for the stakeholders to express their views. And there has been no timely publication of their ideas and proposals, and they have failed to address the opposing views before endorsing the proposal. The LWB officials were there. If the LWB wants to ram this through, I would say the government has distorted the facts. This would certainly prevent the scheme from being a success. As a last resort, the elderly and the relevant organizations would have to launch a full-scale protest against the proposed means test. And we would request that all the future meetings of the EC be open to the public and relevant organizations. We also want the government to retract the proposal and consult everyone properly, so that the elderly would be given an opportunity to air their views. There should be more public discussions. According to the government, nothing about livelihood issues is insignificant. We have an aging population. It's important that we engage the elderly in the processes. Mr. Lee Siu Kao. Thank you. I strongly oppose to this RCS voucher scheme. It's really a rotten apple. You are asking people to pick one rotten apple out of a group of rotten apples. The elderly will be having worse services, and once they join this scheme, they cannot continue to wait for subsidized homes. And it's not realistic to peg the value of the voucher at the rate of EA1 homes. The waiting time for EA1 places is just 8 months, but many elderly people would not want to use their services, while for the subsidized home, the waiting time is 3 years. Many carers and elderly people are misled into thinking that the voucher would be, allow them to go to a residential home of their choice. The government has failed to properly monitor residential homes. The government has created an additional assistant director post to enhance inspection and to provide guidance to residential homes. The proposal in itself is reasonable, but how well the monitoring can be done depends on the law. Well, if the law is not updated, it would be a futile exercise. The ordinance was enacted in the 1990s. There are many loopholes. The per capita space entitlement, the staffing, the manning ratio are too low and outdated. There's a need for a complete overhaul of the law. Therefore, given that the monitoring system is inadequate, I oppose to the launching of the RCS voucher scheme. The government should shelve it immediately, and also the second stage of the CCS voucher scheme should be suspended. And also you should impose a criminal liability for operators who abuse elderly residents. And the $800 million for the voucher scheme should be used on subventing the recurrent services under the community care system. I oppose to the voucher scheme. Ms. Chang Lai Ling. I want to advise the officials, the EC, and the consultants like this. We are disappointed. As other deputations have said, on the 20th of April, we met SWD, LWB, and the consultants. On our side, we have community organizations, stakeholders, and elderly people. We will promise a further meeting for discussion, and then there will be a consultation in the districts. But suddenly, in a rush, on the 7th of June, the report was endorsed, and then now you want to implement the proposals. Secondly, we are not opposing to the money follow the user principle, but the voucher value is not set to reflect the costs of care for elderly people with different physical conditions. There should be the setting of service standards of different categories of homes. First of all, you have to look at the manning ratio. And there should be a costing exercise of community care services. And also the residential homes ordinance should be reviewed. Although there is a monitoring system on service quality, but this ordinance has not been improved in the past 20-odd years. We are very concerned by the recent fire of the mini storage in Ao Chi Wan. And we know that in all industrial buildings that there's no requirement of a sprinkler system. That reflects the need that the law must be updated to keep up with the times. So there's the need to review the standards of service. LWB, SWD, and the sector have been very consensus in costing exercise and assessment tools. So we have been working together on all these fronts. So why is it that there's such a rush? We should have cost-effective indicators first, so that we know where to go and the future direction to take. This would give people the confidence that whatever new system is adopted is going to be sound and feasible. We are opposed to the hasty implementation of the voucher scheme. Mr. John Kay. Thank you, Chairman. Good morning. We are opposed to the co-payment arrangement. The discussion on the voucher scheme is a process that involves a fake consultation, and the promise made has been broken. We cannot tell the level of commitment on the part of the government, and we don't know what the consultants have committed to do. The former chairman of the EC obviously ignored these opposing views, and he said that the pilot scheme on the voucher scheme will go ahead. We think the EC is no longer an effective communication channel for the public, for the stakeholders to air their views. Many elderly persons, carers, their organizations think that everyone will be given $13,000. But if your assets exceeds $400,000, you're only going to get $3,000. So that's the difference between $13,000 and $3,000. we object to the idea of means test for long-term care. And the government should ensure that all future EC meetings will be conducted openly and allowed stakeholders and relevant organizations to sit in. The truth is, the government wants to reduce the cost on residential care, and the standards are set at the EA1 standards. In the future, if an elderly person wants to have access to service at a standard higher than EA1's, the government would not make any commitment or will not pay for them. That is to say, the elderly person himself will have to pay for them. Next, Mr. Choi Seng-kyu from Elderly Service Network. Our colleagues have had a discussion. We unanimously oppose to the launching of this RCS voucher scheme because we think the voucher scheme is not able to enhance service quality of residential homes. Even for EA1 homes, there's a lot of room for improvement. The space entitlement is on the low side, and the manning ratio is also low, and service quality of workers is on the low side. We should aim for improvement of EA1 homes. In the future, even after the voucher scheme is in place, these users will be admitted to homes of EA1 standards. Those voucher users will be admitted to inferior homes. You should provide the resources. You cannot ask for improvement without providing resources. And now you want the users to contribute towards the resources because that's the co-payment approach.
So for RCSV, now you have introduced a new concept of co-payment. In the past, the government would provide resources and the government would monitor. So for the new monitoring mechanism, there will be 5 tiers. Actually, this can already be done under the present system. You don't have to implement the RCSV scheme. Now, the SWD can continue to enhance its monitoring of RCHEs. As for elderly persons and their family members' free choice, just now I've heard that there is a trial period of 6 months and the elderly persons can move to another RCHE. Actually, this can be incorporated into the existing system. Now you have a purchase place scheme, but you cannot move to another RCHE. But you can also have a 6-month trial period in place, and that will be the same as RCSV skill. Because now if you join the enhanced bought places scheme, you cannot move. We should provide elderly persons with choices. And also for community participation or community engagement, you have to let us know more about the so-called community inspection. And we can also implement these new measures under the existing systems. I would like to thank all the deputations. I'll give the Secretary some time to respond, but I would like to summarize. Some deputations talked about long-term care for the elderly, and some also talked about elderly persons who are not moderately or severely impaired. So how would you provide RCS to them? And also, some of them are very concerned about amending the code of practice for RCHEs. And some asked, how come you haven't consulted the 18 districts? Some object to the means test, and some mentioned that for level 0 elderly persons, they would get $12,000, but for the care supplements, where does it come from? How come there is such a system suddenly? And after 6 months, can they move to another RCHE? What are the procedures? And how about the workload of the case managers? They have also talked about the service quality groups and how they are going to operate. I'll give 5 minutes to the Secretary first because I want more discussions. I would like to thank the 30 representatives for their views. Some of them support our scheme, some of them object to our scheme. I would like to respond in principle, and I'll ask my colleagues to answer about technicalities. Now, some object to the scheme. Some think that we are rushing into it. Actually, we are not doing it in a haste. Actually, if according to the timetable, we have delayed a bit. Actually, this should have been done last year because we want to listen to public views more. We want to assure quality. So we asked the consultant team to look more carefully into this. And the EC has been very stringent when it looks at all the recommendations. So we are not introducing this in our rush. And there have been some misunderstandings. For example, for the CSSA recipients, would they be losing out if they take up the RCSV scheme? No, actually they will be getting more benefits other than the $12,000 voucher value. If they need to buy formula milk, if they need to buy diapers, we would also be providing them with subsidies. And also they can still apply for OALA and OAA. So they would not be getting less when compared with CSSA. Actually, they will be getting more. This will benefit them. They will not be losing anything. Some opine that what will happen after the 6 months trial period. Now, if they want to move to another RCHEs, definitely they are allowed to do so. Well, our case managers will still provide service to them after the 6 months. It's not that they will stop their service after 6 months. Just now, Ms. Lam Yukil asked what will happen after the 6 months. As long as they stay in the LCSV scheme, the case manager will be following up on them. They would give them opinions. If they do not want to stay in a certain RCHE, they definitely have the right to move to another. And please don't be overly concerned about monitoring. We actually attach great importance to that because we want to ensure the well-being, safety, and interests of the elderly persons. We want their family members to rest assured. Dr. Choi made a very good remark, that is, there will be a 5-tier monitoring mechanism, and it will be very clear. If the elderly persons are unhappy, they definitely can withdraw any time. They would not lose anything. So these are the principles. And you also mentioned the means test, whether will be very strict. Actually, it is not too strict. For the CSSA recipients, there will be no impact on them. They will just be getting more if they move to this new system. Well, some elderly persons are waiting for non-subsidized places in subvented homes. So for the non-subsidized places, well, while they are waiting, they would be staying in private homes. However, with the new scheme, they can live in the home they want immediately, or they can wait for their places at the place they like. So we have heard your views, and we understand that there are discrepancies among private homes but certain private homes are of high quality. You have a misunderstanding that we are sending elderly persons to EA1 homes. Well, we are just talking about EA1 levels, but subsidized homes can also provide this service. So for the first phase, we have 250 places, and they are places in subvented and contract homes. We have a very detailed plan. We are more concerned than you are, because if there is any problem, it's our fault. You will criticize the government. So we definitely won't do it in a rush, and we will be responsible. Thank you. I will open the floor to members, and let us talk about the time first. I want to handle Mr. Leung Yiu-chung's motion, and I would also like to ask the deputations whether they want to speak again. So at 12:30, will you still be here, members who are here now? Because we just have a quorum. Do you need to leave before 12:30? Mr. Yik Chiming, when will you leave? I can't tell. Okay, then we will handle Mr. Leung's motion in half an hour. If there's still time left, then I will let the deputations speak again. Let me read out the list. Yiu Si-wing, Leung Yiu-chung, Leung Kwok-hong, Chen Chi-chun. Mr. Yiu Si-wing, 4 minutes. Thank you, Chairman. Our population is aging, and we have more needs for RCHEs. The government is responsible for this. We have to face the reality squarely. We want changes overnight, but in up to July 2015, for those who are on the central waiting list, the number is over 25,000. We all want changes overnight. If we don't accept any new proposals, then we are just dragging our feet. We are depriving elderly persons of their right to choose. So you have to strike a balance between ideal and reality. Now, some oppose the scheme, and some say yes to the scheme. So for this LCSV pilot scheme, it can solve the problems of some elderly persons. Well, they do not want to move to another district, and they may have certain means. So LCSV would be helpful. The scale is not too big. In 3 years' time, there will be 3,000 vouchers, and the amount is $800 million. Some say that the $800 million should be used to improve LCS, but this amount is not enough to solve all the problems. Now the government has earmarked this amount. I hope we can look at the issue from another perspective. This is a trial, and after a trial, we can review. And you are concerned that with the launch of the LCSV, other government policies for the elderly would be abolished. The government will not bear the burden anymore. So here's my question. So you're going to launch the LCSV, and after 3 years, you will conduct a review. In the interim, would you make adjustments so that it would be more effective? So within the 3 years, what would you do? And secondly, we are more concerned about a long-term elderly care policy. Do you have a timetable? We want to know that the government is constantly improving. Do you have a timetable? Secretary. Thank you, Mr. Yu. Yes, you are right. We have to strike a balance between ideal and reality. We are all concerned about the elderly. We may have different views. So why don't we join hands to reach our goals? We respect the elderly, and Hong Kong's population is aging. We may have different views, but we should have the same goal, that is to give elderly a better life. Now, this is a pilot scheme. We are trying things out. We will make adjustments. We will make improvements. And for the first phase, the number of places will be 250. As for the second phase, we can make adjustments. So everything is flexible. We will look at the actual needs. And while we are perfecting the scheme, we will have an interim review and we will have an eventual review. Mr. Yu, you are right. That is about long-term plans. Well, Dr. Lam is leading the EC, and they are now looking at a long-term elderly plan. We will have a long-term plan for 2030. So for all our CHEs, we will have a comprehensive plan. This, well, Dr. Lam has been working on it for 2 years. We have spent a lot of time and made a lot of efforts. There will be a comprehensive plan. We will be letting you know later. This is not just about this pilot scheme. We will be looking at everything. How about domestic care? Because we have a principle of aging in place as the core and institutional care as backup. So how will this be implemented? All this will be looked into. Mr. Leung Yiu-chung, I would like to thank the deputations for coming. Many of them have asked a question. That is, they complained against Dr. Lam Ching-choi. In April, you met with some elderly persons. You made a promise. You said that you will go to the districts to consult them, and a follow-up meeting would be held. But it seems that you didn't do that. Is that true? Before Mr. Lam answers, let me say something. Just now, many representatives criticize Dr. Lam. I think it's unfair. If you want to criticize, you criticize the secretary, because I'm the accountable officer. Dr. Lam is just a volunteer. He's doing this on a voluntary basis. Please try to understand. They are making use of their private time. They do not get any pay. Please do not attack Dr. Lam personally. If you want to criticize me. I'm the responsible person. Dr. Lam, I would like to thank Mr. Leung for his questions so that I would have a chance to answer. Just now, some deputations said that, well, on the 20th of April, I took the office of the chairmanship of the elderly person, of the elderly commission, and I met with some elderly persons. I was the vice chairman and now I'm the chairman. I have always been willing to listen to the views of stakeholders. I particularly attach importance to elderly's views. At the meeting, I said that if I were invited, I would be happy to go to any consultation sessions in the 18 districts, or even go to different organizations' consultation sessions. And after the 26th of April, I received some invitations and I did attend. I think that some of you have met me after our first meeting. I have heard a lot of views, and these views were conveyed to our team. The study team has taken your views into consideration. We have made a lot of changes after listening to your views. Just now, Mr. Leung said that there should have been a formal follow-up meeting. Yes, I said that we would try to do that. I understand that the Secretariat is liaising with stakeholders. We originally planned to have that meeting in June. However, due to the time constraint, we have to do it in July. As the Secretary said just now, this is a study report. The responsibility of the EC is to look at the report, to study the report as to whether the government will implement it. This is the government's responsibility. As the EC, we have the responsibility to give our comments, and we would have to look at this study and try to find out whether it's acceptable. And if it is, we will submit it to the government. We did that. We try to arrange for enough sessions to listen to the views of stakeholders. And if the government is going to implement the scheme, we want to make sure that the recommendations are realized. I understand that you are very concerned about the quality of private homes. We spent at least 2 years on that. I believe that was enough time. Well, can I ask more questions? Well, Dr. Lam, you said that there have been consultations, but after the 20th of April, you started your district consultation, and on the 7th of June, you already endorsed the LCSV scheme. How come within such a short period of time that you could make a decision? Many deputations said that they hope you will do it more carefully. It may take a longer time for you to do the study. So for the amount of $800 million, they should be spent on improving the existing services. If you do it in such a hasty manner, I don't think is appropriate. How many of you agree with me? Please raise your hands. How have you really listened to the views of the elderly persons, and how are you going to follow up?
1
minute, please. Well, we're walking on both feet. In terms of community care service, this line of aging in place needs to be strengthened. Therefore, since last June, we have put resources into 1,660 places to improve community care services. And also, for low-income families, we've launched the subsidy for the carers, raising the amount from 2,000 plus to 4,000. And we've also stepped up community care. So don't worry that we will neglect the community care for the sake of this voucher scheme. This is a scheme to help the elderly people and also to provide a more flexible supply of places. So the schemes do not contradict each other, or one will be carried out at the expense of the other. Next one, Leung Kwok Hong and then Chan Chi Chun. Leung Kwok Hong, I think the issue is that, well, people said that there's not enough consultation, and now the scheme is almost been decided upon, and you're going to launch it. So, but still, there are people sitting here today, many of whom are opposed to the scheme. The NGOs may not be providing direct services, and even those NGOs oppose the scheme. So, you have a plan here, objective by many stakeholders. How are you going to resolve that? Unless you want to organize another round of consultation. So you're just putting that in a difficult position. Wherever we have schemes like this, public hearings on a Saturday morning or during the week or late afternoon, for all those public hearings, the stakeholders often express the opposition in Legislative here. So whatever or however you look at it, not including the members from the functional constituencies, they are under the basic law. empowered to monitor the government. So what should we do? Well, Yu Zewing told me, who's sitting next to me, said that, well, why don't we just endorse it? But I said no, because even if you are doing it your way, there are so many views expressed. How can you go back? Or can you possibly rethink the scheme, having listened to all the deputations this morning? So, Secretary, well, you're supposed to fight the fire today, but well, it took, you couldn't really put out a fire in 4 days. So now that for this scheme, you need more time. It took us 4 days to put out a fire, and yet it's still burning. But you're supposed to be putting out the fire here. Secretary, so Mr. Leung's question is whether we will amend further the plan or to enhance the scheme further. Indeed, the Elderly Commission, under the leadership of Dr. Lam, had already looked at all the public opinions and demands. And, for example, in the example of case management, that's a common request from the sector. The welfare sector has asked the government to do that for a long time. Chairman, I think he didn't put it right. The CE in his policy address said that this should be done, and then they came out with this plan. They're just here. I think all things happen here in LegCo. But he said that we listened to views. There are problems with the Constitution, and now you have this order to carry out. So what can we do? I think this is really ironic. Every time, whenever there's a chance for you to use this LegCo platform to get people to express their views, and yet the same outcome every time. Ms. Levi said that I was filibustering. We don't want to see filibustering, but I, as an elected member, what can I do? Secretary, the chief executive in his policy and address in 2014 asked the Elderly Commission to carry out a feasibility study. And according to the timetable, well, you know that we had a delay in the scheme feasibility study. We did ask, and then asked 2 consultants, experts from Hong Kong U, to collect views and do a detailed analysis and to look at office experience, the best practices aboard, and the Elderly Commission look at the evidence, the views, analyze the views from the community, and there's also the involvement of focus groups, public participation. Now we are here to present our views, and the whole process has been very fair and open and transparent. Okay, next one, Chen Chi-chen. Well, I'd like to thank the deputations for coming here to express their views. I think your stance is pretty clear today. People operating homes, of course, would like to see the scheme implemented, this trial scheme implemented ASAP, so they can get more resources to make improvements. Yet, many elderly people have much doubts and reservations about the scheme. They are even dissatisfied with it. We heard it very clearly today. So just as the Secretary said that we're not acting in a rush, we have delayed the whole thing. But you have only delayed your own timetable. You control the pace of things. But when it comes to the pace of implementation, when to launch a scheme, you need to do that only after consultation is done. If you say that you are falling behind schedule, does that mean that the consultation is useless? Is it that you can listen to views next year afterwards, but you will still launch the scheme as planned? I don't think that makes sense. It's not that we're filibustering on livelihood issues. We've heard from elderly people who said they don't want to pocket it now. They don't want to pocket it. Please raise your hands, those who don't want to. It's very clear. So I'd like to ask the Secretary, you always said you want to vote with your feet. It's not easy, really. Even for us who use our own money. I tried to find a home for my mom. You know how difficult it is to change from one home to another. Also, there are the costs psychologically and so forth. When a old person moves into a residential home, their bottom line will keep coming down because they wouldn't tell the children even if it's so bad. And the children would not know how to monitor a home because they thought that is the normal state of affairs when a home is smelly, dirty, and so forth. Even when my mom get gets hit at the home, she could not change the home immediately because you are actually waging a bet every time you want to change to a new home. Therefore, the government has to monitor to make sure that there are qualified services in the market. Otherwise, well, in theory, you're giving us money. In theory, I give you money and you should be very happy and give us what I want. But indeed, you can't buy qualified service in the market. But I agree with a few things. The monitoring system and the home system should be separate. Monday, Secretary, you will come here to set up the request for money to create posts in the licensing office. So even without the voucher scheme, which is not to be launched tomorrow, I mean, no matter what, you will have to come to get the money, the funding. But Leung Yiu-chung today says that it wants to improve the monitoring system and only launch the voucher scheme after the law is improved. But you can't change the law in 1 or 2 years' time, so it's up to the Secretary to make a promise. I don't think the Secretary will come. You may not come to our establishment subcommittee meeting on Monday. But how about the improvement in the monitoring system? That has to be done. But some organizations have asked to bundle that with the voucher scheme. Otherwise, just pushing ahead with a voucher scheme without a proper monitoring, well, we'll just look at the monitoring as a trial scheme. So if you bundle them together, that means that we can't change the monitoring scheme. Well, Secretary, yeah, Mr. Chen, you said it right. Both are separate issues, but both are equally important. Just then you suggested the option of pocketing the scheme. No, that would not be possible because elderly residents will have a choice. They won't be forced to join the voucher scheme. If they're not happy, they can wait for subsidized places. We won't threaten them or discriminate against them, force them to accept a place. If you say that I like home A, home B, and you want to wait for 4 or 5 years, you can keep waiting. If you don't like Chinese cuisines, if you prefer Western cuisine, I won't force you to go for the Chinese food. I don't see what negative impact there can be. We're respecting elderly people's rights. So there's not such a thing as pocketing the scheme. And also, you worry about quality. We are even more worried than you about quality because we have to be held accountable if anything goes wrong. So we need to make sure that the monitoring work is well done. So we need to enhance the indeed monitoring. You're worried about the need to change the law. We are aware of your request. We have said it very clearly that we will look at the actual need and see what can be done. If you want the timetable, I can tell you. Give me more time, please. I would look at the care and attention option, and by the middle of the year, we will initiate a review of the ordinance. That's my promise. Please don't focus on that post of an assistant director criticizing that post idea alone. Okay, next one is Yik Chi Ming. Well, I'd like to thank all the deputations for attending today's hearing and your views. It's not the first time I heard the concerns from the deputations. I've also heard explanations from the Secretary several times. But it seems like so far there are problems with the communication. I don't understand. Seems like you have all conspiracy theories, criticizing the government's voucher scheme. You think that the government is trying to shift its responsibility to the private market. But the Secretary said that they will continue to optimize the system and monitor things. So the Secretary also said that we're giving, through the scheme, elderly people a choice. Our Liberal Party always supports the concept of money follows the user. You give the users money, then they can choose where to change a home. I know that there are a lot of inadequacies now. If you want to change the ordinance, you want to train up the manpower, it takes time. Then should we just wait and do nothing now and let the elderly people be deprived of good services? I don't think that's the right path. We should do whatever can be done now, and you are welcome to continue to give the government ideas on how to optimize the system. I also like to ask the Secretary, in the current term of the administration, the resources invested in welfare for the elderly people, how much has the increase been? You can provide information to us later. I know that the government is putting more and more resources on social welfare. Is well beyond the restrictions posed by the Basic Law. So can you give us an idea that, or give us a message that the government is not trying to absolve itself of its responsibility? Well, we are putting more resources into elderly care, looking at the macro scene, the welfare protection expenditure, including services and protection in terms of cash and medical expenses. The latest figure is like we are spending $662 billion. That's 19% of our government expenditure. That is, of each $100 spent by the government, $19 are used for elder people. That is expenditure on me and Dr. Lam, elder people. That comes to $62 billion. When our bureau was set up in 2012, the expenditure reaches rose from $4 billion to almost $7 billion. We will continue to get more resources. So you can see that there are actually a series of plans, including the private sites scheme. There will be a additional supply of residential places under the privately owned sites for welfare user scheme. So the expenditure will only increase and not decrease. Yi Qiming, well, Secretary, you just heard from deputations that, you want the elder people to join the trial scheme, and that would mean that they will get fewer subsidies from the government. But you said that that's not the case. But how can you, or what can you say to let the welfare sector be clear that you're not cheating them? Yes, I want to say a bit more now. Those who are participating in the scheme, those who are on CSSA, would definitely not lose out. Instead, well, indeed, their family members can contribute more. For CSSA, that's not possible. Even when family members want to contribute, you cannot get contributions under CSSA. So the voucher scheme represents an optimization, of a welfare scheme. The family members can pour in their own contributions openly. So why can you stop that? Why should you stop that? And let me also say this: for all welfare organizations, servant organizations, we will not reduce our support for them. We will remain as partners. Without welfare organizations, we will not be able to provide that many places, and without private homes, we will not be able to subsidize the places. So we are one family. Thank you. So it's now my time. I'll use up my 4 minutes. Just then, Secretary mentioned that the improving home care service, the 1,600 places concerned have always been subsidized, but you would extend the service without new resources for community care services. So I don't see how you can actually upkeep the service. And there are also many views expressed today concerning the residential care homes ordinance and the review for the code of practice. I know that people will ask you later, but Secretary, since you're here today, I'd like you to tell us your stance on that. Please be more clear, not be vague. Please tell us that if you're going for a review, what about the timetable? Can you give us a concrete answer? Secretary, please tell us. The residential care home ordinance, the possibility of a review of that. Okay, on your first question, 1,600 places, that's not meant to cheat people. They are really newly added places. And for the home care voucher, we are having a trial scheme with it. So we increase the number of places from 1,200 to 3,000, and they will be carried out for another 2 years. So actually, elderly care is a priority for the government, of all policies. So we will only implement what is feasible. But people have been concerned about the review of the ordinance, and people have said a lot about the assistant director post. Please rest assured, we are very, very concerned about quality assurance, and the ordinance is an important cornerstone. But I need to wait till the EC, led by Dr. Lam, waiting for the Commission to look at the overall plan. And by the second quarter, hopefully by the second quarter or middle of next year, we can have a blueprint for an overall plan to look at the hardware and quality of staff. Because you can't just look at one element like aging in place or homes. We need to look at the whole sector and then see what review is possible. I hope that by Monday, Mr. Leung, you can support the creation of the assistant director post. Please don't give our colleagues a bad time. So that is, you will activate a review of the ordinance. Yeah, we have to receive the report first, and after we have got a report, then we will initiate or kickstart the review of the ordinance. Okay, I've still got some time left. The level O supplement for level O. Can you give us a paper afterwards? You mean the care supplement? Yes. Just then, Ms. Lam UQ asked the question in relation to that. My answer is we've got a $800 million for the trial scheme, and we will take the money from that. Because this is a trial scheme, so there's money devoted to it, and so the care supplement is part of it if it works. My question was, can you give us more details about the items covered by the care supplement? Well, it means special diets, diapers, milk formula, daily supplies, daily expenditure. For those on CSSA, they will enjoy the medical waivers under the public health system. But we are going to give monetary subsidy to the homes. I know members want to have a second round, but I said that we would deal with the motion first before dealing with the second round. So I ask Leung Yiu-chung to speak, please. Chairman, I think the motion is very clear that since the qualities of service of private residential care homes are disappointing, and there have been incidents of elderly residents being neglected and abused, and now the manpower establishment and space of those homes are not satisfactory. Before the monitoring system and the ordinance are improved to enhance manpower and also the centers for services, the committee would actually object to the implementation of the voucher scheme.
I think that's exactly what we have been discussing. Mr. Yu Si-wing. Well, here's my comment. If we want to improve the monitoring system and the law first, that will take a few years. So I hope we understand what's at stake. All right, if there's no proposed amendment, I'll now put this to the vote. Mr. Frederick Fung, we are now dealing with Mr. Leung Yiu-chung's motion. I'll now put this item to the vote. Will those in favor of this motion please raise your hands? 5, me included. Those against, please raise your hands. 2. Thank you. So we just record the results. It's carried by a majority. Now it's time for the follow-up questions and comments. May I remind the individuals and deputations, well, you will be given more time to speak. It's about 1 minute. Do we have anyone in the first round? If not, then let's have the second round. 3 minutes, Mr. Leung Yiu-chung. the secretary keeps saying that this is a pilot scheme. It's not mandatory. You can opt in, or if you don't opt in, you can continue to wait. Well, it's a very casual remark. People have been waiting for years. What are they waiting for? They want to be admitted to the homes with service quality improved. Why do they have to wait? Because the community care for those living in their own homes is not sufficient. That's why they have to go to a RCHE. Well, okay. Well, if they are asked to wait, it's all right. But what about improving community care? If you take a good look at my motion, I'm not saying that the scheme should be abolished. I'm just saying that why can't we deploy the $800 million for community care, given that there has not been sufficient consultation for the new pilot scheme. And you haven't been able to achieve a meal delivery service during holidays. So what more can I say? I think that this is a very careless remark that people can choose to wait. Are you not aware that the current situation with community care for those living in their own homes is not good enough? Just look at meal delivery during holidays. So can you give us more specifics as regards improvements? Mr. Leung, I think you have distorted the facts. This pilot scheme offers one more choice for the elderly. It would not affect the allocation of RCHE places, so it cannot be said to be a careless scheme. We are not depriving the elderly any right. We are giving additional 3,000 places. The $800 million is an additional funding. Only those who object to the scheme are careless. We are being helpful for meal service delivery on holidays. The service will be provided if necessary. Those living alone will be given the service. The service providers know this kind of very clearly. If they refuse to do it, they will take follow-up action. But on a holiday, sometimes the elderly people would have tea or have meals with their family members, and they don't need the service. Well, am I being careless? Hands up? Okay. For those who think I'm not careless, Mr. Leung, go home.
其實嗰個問題，
he speak to the mic. I think the secretary doesn't know what's being said. It's okay to allocate. We said that we want to allocate $800 million for community care because there are so many people waiting for RCHE homes in the private sector, even if you can afford it. And now community care is not good. Service for those living in their homes are not good. So we want to improve those services so that they don't have to, they won't be forced to take up the 3,000 places that you're offered. It's okay to offer 3,000 places. If the 3,000 places are for all, and it's all at EA1 standards, or it's a right for all and forever, of course we welcome it. The point is the pilot scheme cannot resolve the perennial problems. Because of the lack of places, they have to gain access to this scheme. For those who are rich, it's another problem. You are not able to buy the products even if you are given the money. Say I give you $65 billion more, you are unable to deliver. Well, you are distorting the facts, not us. Well, your government is not even able to put out the fire for 4 days. What kind of government team have you got? You are not dealing with the major problems. And for this petty subject, you are here to pay us lip service. Please take a good look at the motion. No one is opposing to any attempt to improve elderly welfare. We are saying that when you purchase something, make sure that you are purchasing something of good quality. Not. We don't want anything offered by Cambridge. And some smaller RCHEs are saying that they are not given a chance to participate. So, please, you have to read the motion carefully. Mr. KK Fong, 4 minutes. Well, I support Mr. Leung Yiu-chung. Well, originally I didn't want to speak.
究竟成個嘅安老服務嘅重點係咩呢？咁點解個重點嘅嘢未做？
Well, what is the core issues for elderly care? We haven't been able to handle the core issues. We haven't been able to deliver. The waiting list is so long, and therefore you go for such gimmicks to attract some people away from the long queue. For the non-subsidized RCHEs, many of them have problems. Problems are very obvious, and the government are not able to handle those problems. And now you come up with a new gimmick. Then I would say that please return to the core subjects. Please look at the manpower situation. Why is it that the long queue cannot be shortened? From the Welfare Services Panel, from the Subcommittee on Elderly Services, and another subcommittee on poverty alleviation, we have been asking the government to provide sufficient premises for RCHE places. And is it that the government doesn't have the money? The answer is no, no, no. It's just that you don't want to do it. You are not willing to do it. And it's your bureau's failure. And now you spend a few $100 million on one gimmick after another. We want you to take care of the most essential services, the services most needed by the elderly. So we would rather that you don't go for new gimmicks. You think that we are careless. I think, well, now the motion has been passed. It's the decision of the Council. It's just like the referendum in the UK, although it's just a difference of 4 percentage points. I'd take great objection and repulsion at the Secretary's remarks. Well, I don't need to be here to know what's going on here. I can tune in on the in my office. I said that this is just an additional option. We are not coercing any elderly people to do it, to accept this. Well, I'm asking you to return to attend to the core business and core issues. Don't go for gimmicks. When we ask, you offer everything, but not sufficient is offered. Although we have inadequacies. Well, the inadequacies are long-standing and you never accept our views. All right, Secretary, maybe you can respond later. You have no respect for us. I'll use my 3 minutes in the second round to ask some questions of the consultants. According to the findings of your research, those whose aspirations will not be affected, even if there is means test, that accounts for more than 10% of the respondents, and 12.3% of them may avail themselves to the new pilot scheme. Those living in the community with no community care provided, 12.6%, and those with community care, 10.4%. These are people receiving community care services. Why is it that only 10% of people are agreeable, and we want to impose this scheme, and there are only 250 places? Or under what circumstances would you continue to implement this, and under what other conditions would you stop the implementation? 6.9% of them are living in RCHE, public or private. Does it mean that we don't need to build more RCHEs? Well, it's a matter of choice. I hope the elderly will not give up their homes in the community and to be admitted to RCHEs. And only 11.3% of elderly respondents will choose the LCS voucher, even if there's a means test. We believe that that's a sufficient basis to start a pilot scheme. If we want to try out something to achieve, to see if it achieved the outcomes we want, so we have based our decision on the study and on the views expressed. We don't yet know the outcome. The important thing is that there should be regular reviews after the pilot scheme is up and running. So we believe the percentage of 11.8% will be a sufficient basis to implement the pilot scheme. Under what circumstances are you going to suspend it or abolish it? Well, if there's no willing participant, do you have any cut-off figures, a percentage, under which the scheme will no longer be implemented? We don't have anything like that. Who would like to speak? Deputations and individuals? Hands up, please, and steady.
好，呢邊有冇啊？唔好意思，冇。
What about this side?
5、6、7、8、
11.
12係嘛？唔係，多咗個13。有13位。
13. So maybe in the same order, for speakers, everyone is given 1 minute, and then I ask the secretary to respond. Ms. Chan Sun-yin, for the elderly people with serious impairment, they need to be cared by a nursing home, but there isn't a lot of quota for nursing home. How can ordinary RCHEs care for elderly people with serious impairment, so they can only go for this voucher scheme and go to a private RCHE. And if you think that the aging in place scheme, why has there not been a third stage consultation? And why can't you wait until the later stage of the community care scheme has been implemented before you launch this RCV voucher scheme? Why can't Ms. Lee Fai? Why can't we be more pragmatic and think about the problems arising from an aging population? If you ask me the kind of RCHE that I would like to go, well, I certainly don't want to have go to an RCHE offered by an NGO. I would like to go to the elderly housing scheme at Tanner Hill, but can the government afford to offer this to everyone? We have to carefully think about this. We know that this pilot scheme means an additional choice for the elderly. So my association will set up a self-regulatory committee. We know that we are low in competitiveness for those member RCHEs which are not abiding by the rules. Their membership will be disqualified. We know we need to improve ourselves. You want to have dozens of officers to be deployed and an additional assistant director. We know that the RCHEs are not sufficiently staffed, and that's not going to be resolved by enhanced monitoring. I'm not saying that Mr. Leung Yu Chung is careless. When the secretary says that this is just an additional choice, I just think that is a bit too much to say that we shouldn't be giving people one more choice. I want to review some of the arguments in support of the voucher scheme. It said that when an elderly person is discharged by hospital, they would have nowhere to go but to a private home. But if we can increase the resource for community care, then a discharged elderly patient can remain in their own community, and they don't have to go to a private RCHE, which is not properly monitored at the time. And they said that some people want to keep their vested interest, and they don't want to have the voucher scheme piloted. But under the scheme, we have been trying to improve quality, but we don't think that for-profit RCHE can do the same. We have collected some signature from social workers voicing our opposition.
Just now you are saying that the other side is unsympathetic. I think the government is really unsympathetic. Well, earlier on, you had a consultation on retirement protection. The Secretary and Carrie Lam have already stated their position. That is, there will be no universal retirement protection without means test. And now, even if an elderly person wants to move into an RCHE, there is means test. This is actually a significant change in welfare policy, because for the means test, now it's over half of the cost. That is for service users. They may have to pay for the majority of the fee. In terms of welfare development, this is a significant change. I don't think we should endorse such a significant change in such a short time. Your 1 minute is up. First, for the CSSA elderly recipients, yes, we understand the situation, but they also have to go through the central waiting list. It's not that because they are CSSA recipients, they can get the RCSV. So shouldn't they be given the same level of service? Your time is up, Mr. Poon Siu Man. Just now, the Secretary said that Dr. Lam is a volunteer, so we should direct our questions at you. So I am now asking you a question. You have been the Secretary for 4 years. You are the most unsympathetic one. You now come up with this idea of LCSV. You are pushing the elderly persons into hell. Why don't you review the government's long-term elderly care policy? And how come you are pushing the elderly into hell? Now I will ask you a question. From 2016 to 17, there will only be 998 more places. It's only 1/3 of the elderly persons on the waiting list. So what problems are you facing? And how come you are spending so much money on white elephant projects, but you are not making any improvement to the RCHE places? Mr. Lokoya. Thank you, Chairman. Well, some people have misunderstanding of private homes. They are accusing us of profiteering and of monopolizing. Well, the Cheung Kong company may be doing that, but we are not. We make a lot of investment, but our return is minimal. If you have time, I would like to share with you about our investment and return. We are doing our business with conscience. Please take a more careful look. Mr. I, as for LCSV, is providing the elderly with another choice. If you don't give them another choice, it's not just being unsympathetic, it's being cruel. Mr. Fu Wenpeng, Chairman, the government is going to put $800 million into LCSV. Nobody likes that. Most of us object to it. For that $800 million, why don't you take out $500 million from that, and then you can make improvements to the existing LCS, and they can really age in place. Mr. Wong Shui-Wah. Well, the LCSV is a new choice. Yes, I can understand that. However, when it comes to monitoring, if it's not properly done, then I'm worried that there will be a lot of disadvantages. After 3 years, yes, those 3,000 voucher holders may benefit, but still there are tens of thousands of elderly persons who cannot benefit. But the LCHEs may have increased their fees, and this may be a major disadvantage. You cannot monitor them, and you cannot bring benefits to all the elderly persons. Dr. Poon Yui-Pun. Thank you, Chairman. Well, Hong Kong should be a fair society. For Dr. Choi's study report, he says that 10% of the LCHE residents would like to use the voucher. So shouldn't we respect the wills of these elderly persons? Now, you always talk about quality. How do you assess quality? In private homes, well, you can actually go online to check the accreditation scheme. There are many private homes who have been accredited. They are of good quality. Ms. Lam, for many elderly persons in Hong Kong, they don't really need to live in luxury flats after their retirement. They just want to have basic care, and they want to have a choice. If there is a need, they can be homed in NGO-run LCHEs. So they should be given a choice. But now you are forcing them to choose. And this is also about the government's responsibility for taking care of the elderly. You don't just pass the buck to NGOs. And also, talking about consultation, you have heard a lot of objections. Now you have new recommendations. Why can't you conduct a consultation in all the 18 districts with this new recommendations? This has never been done. Ms. Chan Lai-ling? Well, when we look at the quality, it's not just about private homes or NGO-run homes. It's about the living quality of the elderly. Other than the 5-tier monitoring mechanism, the Secretary said that we should also look at other things. I think the government's resolve is very important. Have I missed anybody? Secretary, can you give us a reply and then we can end the meeting? For Ms. Chen Chen-Yi's question, she says that for those seriously impaired elderly, as outlined under paragraph 10, they would not be covered. They would have to go through the assessment mechanism, and for the moderately or severely impaired elderly, they would be covered. Nursing home is not included. I'm sorry, the speaker is off mic. The moderately or severely impaired elderly who are on the waiting list. Why don't you wait for the Secretary's answer? If you are unsatisfied, you can ask another question later. We are talking about those who are on a waiting list and who are moderately or severely impaired. They do not include nursing homes. And for Ms. Levi's remarks, yes, I appreciate some private homes. They are really making improvements, but some of them are of good quality, some are still of poor quality. So we should be more objective. Now, you really have to self-regulate. Then consumers can have confidence in you. Mr. Law made some comments, so I'm not going to respond. I would like to answer questions. Ms. Lam said this is a major policy change. Well, we are now adopting a new perspective. We think that the principle of money following the user is feasible. So we want to implement this pilot scheme. As to whether there will be a major change to the policy, well, I cannot say it right now because this is just a pilot scheme. But if the pilot scheme is successful, then we will achieve a win-win situation. Well, by then you may think that your thinking today is not that correct. So this is too early for us to say that this is a major policy change. So this amount of money will only be spent on this pilot project. If the pilot scheme is not successful, then we'll definitely make changes. And another gentleman says that we are pushing the elderly into hell. We respect the choice of the elderly. We won't force them, and there will be case managers. Even though they join the scheme, they can withdraw after the 6-month trial period. They can move to another RCHE. There is no problem. As for long-term planning, it will be finalized by the middle of next year, and then we will report to you. That will definitely be a platform for us to look at this long-term planning together, and it will be a planning up to 2013. Just now, Mr. Wong talked about monitoring. Yes, I agree with you. We have to do a good monitoring work, and the SWD is going to increase manpower. We have made an application at the LegCo. We want to increase manpower so that we can enhance monitoring. We will step up our inspection of problematic RCHEs. We will spend more time on them. And it's not just inspection. We will be providing training to the LCHE so that the staff quality can be upgraded. Ms. Zhang said that this is a forced choice. No, we are not forcing the elderly. They definitely have a free choice. They can choose not to join the scheme. We will be promoting the scheme, and elderly persons are free to join. Another representative hopes the ordinance can be amended. Yes, we will be reviewing the ordinance. Mr. Fu asked about community care service. He says that $500 million should be put in community care service. Putting the money in CCS. Actually, earlier on at the LegCo, we have talked about this. These are two totally different issues. For this sum of money is for the pilot scheme. As for community care service, we will also be increasing our injection of funds. As for CRS voucher, the quota will also increase. We hope to do a better job. Dr. Lam, you want to add anything? Yes, Chairman. In the past few hours, I'm happy to hear the views of stakeholders and councillors. Our differences are not that big. Please be quiet. We want our elderly to enjoy better services. The EC has looked at this feasibility study report, and we want to make sure that things can be improved. Now, if we implement the LCSV scheme, would the elderly enjoy a better life? Some of you are worried about the quality of private homes, and EC is even more concerned than you are. So we have to face the problem squarely. And where does the problem lie? Now we have 20,000 elderly persons who are living in these licensed homes with limited resources, and 70 to 80% of them are CSSA recipients. It's about $7,000. So with this amount of money, it's difficult to provide the elderly with a life with dignity. So if the LCSV can provide another path for the elderly, then they do not have to ask their sons and daughters to sign a statement declaring that they will not support them anymore. $7,000 are not enough. And our CSV will increase this amount significantly, and the licensed homes will be incorporated into a strict 5-tier monitoring system. The elderly can live in better quality RCHEs. So this is our position. For the elderly, this is definitely an improvement. As the chairman of the EC, in the future, I will still be very happy to listen to your views so that together we can help the elderly improve their living quality. Let me summarize here. It seems that there are more objectors today, but there are also some representatives who support the LCSV. I think we all should bear the well-being of the elderly in mind. The government hasn't told us clearly what it will do with community care service in the future. The government hasn't made a decision yet, so it's not telling us anything. But you've heard the public's voice. They hope that the government won't just look at our CHEs. Yes, today we are looking at our CHEs, but your policy of aging in place as the core is very important. So you should provide more resources to community care service. Yes, we are all concerned about RCS and its monitoring, so the RCHE ordinance should be amended. The Secretary has given us a positive reply today. But it seems that you are still relying on the ESPP result. I hope that you would be bold enough to amend the RCHE ordinance. It was enacted in 1994, more than 20 years ago. So definitely a review should be conducted, no matter what the ESPP result is. So I hope you will promise us to review the RCHE ordinance. So all the deputations and representatives have expressed their views. I hope you have heard them loud and clear. This is the last meeting of the Welfare Services Panel within this term. Your views will be recorded in our minutes. As to what will the next term of legislators do, they will definitely look at your views in the record. I'll end the meeting now.